lot of changes with Medicare for 2025. Let's talk about that today. My name is Ed Weir, former manager of the Social Security Administration, and this is a live Q&A as well. So if you have questions, make sure you type them into chat. And this is all things Social Security, Medicare, disability, retirement benefits, spouse benefits, survivor benefits. Let's make sure you're getting all the money you're entitled to, that you earned, you paid into all those decades for you and your family. If you're about to file, let's make sure you're doing the right thing. Okay. All right. So all kinds of changes happening here. Center for Medicare and Medicaid Services is trying to pass regulations. Unfortunately, the Supreme Court has now kind of pulled that out of their jurisdiction in some respect. So we're seeing a lot of stuff happening. One thing they tried to do was crack down on steering, where Medicare insurance agents and brokers and health insurance companies, the big ones, would pay agents and brokers a little bit extra for doing a little bit of, administrative paperwork, and they paid them a little bit extra. So some unscrupulous agents and brokers were steering people to Medicare Advantage plans, Part D plans, whatever the case may be, that maybe might not have been the best for them, but it was best for the broker or the agent because they got a little bit extra money. Medicare came down and said, no, you can't do that anymore. We're not going to allow that. Unfortunately, because of that new Supreme Court ruling, Medicare was kind of hampered by a Texas judge. A Texas judge came in. Obviously, a lawsuit happened. Health insurance companies, Medicare insurance companies fought and say, no, we don't want that. So a Texas judge came in there and said, no, they put an injunction on that. So unfortunately, if you're gonna get help from an agent or broker, and they don't charge anything, I put together a team of brokers as well that can help you find the best Medicare Advantage plan, because I was tired of all the unscrupulous and people doing the wrong thing. So if you need help, make sure you reach out. But get with your agent or broker, someone you know and trust, and then ask them, okay, how many plans do you represent in my particular area? And that way you can get the best. So just kind of buyer beware in that respect. Hopefully, something happens with that. But there's still an injunction on that. All right. Another thing that's happening is, in the middle of next year, you're going to get a mid-year notification. And everybody gets a notification in September. Next month, you're going to get a notification. It's called the ANOC, the Annual Notice of Change. So the Annual Notice of Change, if you have a Medicare Advantage or a Part D plan or whatever the case may be, they have to send you the Annual Notice of Change, everything that's going to change for 2025. And this year, I mean, if you've always thrown that away for the last few years, okay, it's a pain in the butt, I understand. But this year, you really need to check it out, because there's so many different changes, and the Annual Notice of Change this year just might tell you that they're pulling out of your area because of all the different changes. Big Medicare insurance companies have already notified CMS, and you probably see it in the news. They're like, yeah, we're not making any money in this area. We're not making any money in this rural area. We're not making any money out in the desert out in the West. So millions of people are going to be losing their Medicare Advantage plans. And how do you know that? Well, you check the Annual Notice of Change. But unfortunately, a lot of people don't check that. And they, starting January, you go in there and to your doctor, and you find out you don't have a plan anymore. So it's very, very important you check that letter. And when you get that letter, keep it, save it. If the letter says that they have pulling out your area and you're done, then again, January 1st, you're not going to have another plan. You're going to have to pay all the gaps that original Medicare doesn't pay. The original, the 80, you have to pay the 20%. Medicare will pay 80%. You have to pay 20%. You have to pay over $1,600 if you go to the doctor and all that kind of stuff. So that's important that doesn't happen. And so you have to make sure that, and if a company pulls out of your particular area, you get a guaranteed issue for a Medigap plan, one of the Medicare supplement plans. Those are the ones that, you don't have any networks, you don't have prior authorizations. There is a monthly premium for those, but a lot of people want to get on those. I get calls every single day. People say, I want to get out of my Medicare Advantage. That's too much of a nightmare, all the pre-authorizations, and they're not covered my doctors anymore. And they want to get into a Medicare supplement, but you can't get into a Medicare supplement after your original sign up unless you go through health underwriting. But if your company, your Medicare Advantage company, abandoned you, then guess what? You get a special enrollment period. So you get a guaranteed issue for a Medicare supplement plan. So make sure if you get that letter saying they're leaving you, make sure you save it. And then when October comes around, then reach out to your agent or broker, or reach out to us, and we can help you find a Medicare supplement plan. And now no more networks, no more, all the pre-authorizations and all the rest of it. Another thing that's changing is, you probably saw this on the news, Medicare Part D. So Medicare Part D, the prescription drug plan, started in 2003. And the only reason it passed is because the pharmaceutical industry didn't want it to pass unless they profited. And the way it passed in 2003 is they profited big time. So you got a lot of people that weren't able to afford their prescription drugs, but the government came in and said, okay, all right, we need to get prescription drugs for people, so let's go ahead and pass it. And the pharmaceutical companies said, okay, all right, but you can't negotiate prices like every other country in the world or the Veterans Administration. And the only reason it passed is because politicians said, okay, we won't negotiate prices. And now people have been charged outrageous amounts, and government has been picking that up, and pharmaceutical companies have been making tons and tons and tons of money. Well, under the Inflation Reduction Act that was just passed a couple of years ago, guess what? Now Medicare can finally, after decades, I guess Biden the other day was saying he's been trying to do this since 1973. And you're saying, wait, Ed, that doesn't make sense. 1973 didn't have prescription drug plan under Medicare. Yeah, they did. It was under Part B. Part B, if you go into a doctor's office and get an injection or infusion or something like that of some type of pharmaceutical drug, then that's covered under Part B, and Medicare couldn't negotiate that forever. So he's been trying since 1973. So it gives you an idea of how long it takes to do stuff. And pharmaceutical companies, they put out over $400 million in lobbyists to stop this Inflation Reduction Act, to stop the ability of Medicare to negotiate prices. But fortunately, they lost. So starting next year, there's a cap on prescription drugs. So the old donut hole has gone away. The max you can pay out of pocket is $2,000. But unfortunately, because of that, these companies, they don't get to be billion-dollar companies for nothing. They have other ways to kind of get some money, and that's what they're kind of trying to do now. And so you see the health insurance companies, they're going to be reducing benefits, increasing, kind of out deductibles and different things. So unfortunately, this is why we really need to be vigilant this year, that your plan with Medicare supplement, you don't have to worry about it. If you have a Medicare supplement, you are good. If you have a G that's getting kind of expensive, you might want to consider switching to another G that's a little bit cheaper on a monthly premium. If you have a G and you really want to save some money, you can switch to an N, usually about 20% cheaper per month for the premium. And you can do that. You can switch from G to G and G to N any time of the year. But you still have to go through health underwriting. So if you're youngish, 65, 66, 67, 68, whatever, and healthy-ish, check to see if you can switch and save some money there. But in terms of Medicare Advantage, you definitely need to watch out for your annual notice of change and see the reduction of benefits, the dental, vision, hearing, gym membership. The increase of cost last year was $100 if you had to go to the hospital a day. Now it might be $200 or $300. Again, they're going to be dropping areas. Millions of people are going to be losing their plans. More prior authorizations, so for drugs and deductibles for drugs and formularies. So, super long story short, this is going to be a terribly complicated annual enrollment period coming here. So, we're talking annual enrollment period October 15th through to December 7th. Nobody knows what the plans look like in your particular area until October 1st. Everybody gets the plans October 1st. So, please, please, please make sure you check out your plan and compare it. And just don't say, a lot of people think that, okay, I've got XYZ Medicare Advantage plan, Medicare company, and I like them. Okay, that's fine. Perfect. You can keep that company. But that company, I almost guarantee, has one, two, three, four, five, six different plans. And they're probably coming out with another plan next year because they always come out with a new plan, just like come out, new cars and new models. So they come out with a new model to entice new buyers to come over from another company to theirs. And what they're banking on is for you to just let it ride. And they slowly deteriorate your particular plan and give all of the benefits you used to have to the new people in the new plans. So it's important that you check your old plan and say, hey, I'm going to upgrade to the new model and get all the other benefits everybody else is. But if you just let it ride, then it's going to cost you. It's probably going to cost you next year. And you don't know until you know. You're like, oh yeah, it's still same doctor, still monthly premium of zero. Oh, I'm good. Nothing changed. And then next year in February, March, April, you fall or get sick and you go to the doctor or something, and they're like, you get this bill for $500 and say, why have to pay for that? Well, should have checked your plan. So cautionary tale out there. So make sure you watch that, the annual notice of change. And then mid-year, that I continue that thread, next year in the mid-year, they will send you that benefit, that supplement letter that basically says, hey, you've got dental, you got $4,000 of dental, you haven't been using your dental. We just want to let you know the government has mandated those letters. And that's another reason these insurance companies are trying to save money in other places, because they've been offering all these benefits, gym membership and dental and vision and all this kind of stuff, and people have been using them, so the companies pocket that money. But now they're gonna have to make you aware of it, and they're gonna lose that money, because you're actually going to use your benefits. So that's why they're trying to find money from other places. Again, these are smart companies. They don't get to be billion-dollar companies for nothing, right? Okay, so let's go ahead, and answer any and all your questions about Social Security. Let's see. Lenore Marie, hi. When can a disabled 61 ex-wife file for ex-husband's spousal Social Security? Husband is 64, still working.